Hello everyone, welcome to this simple, straightforward, but more or less a very factual topic on hypersensitivity pneumonitis. Okay, hypersensitivity pneumonitis. So first of all, let's try to understand what is this entity, hypersensitivity pneumonitis. You can abbreviate it as HP. Okay, hypersensitivity pneumonitis. So what is this disease? See, this disease is, as the term suggests, a hypersensitivity reaction. Hypersensitivity towards what? It is the hypersensitivity towards certain inhaled antigens. Okay, so there is a hypersensitivity towards certain inhaled antigens in your hypersensitivity pneumonitis. So it is a hypersensitivity reaction, okay, to inhaled antigens, okay, inhaled antigens, and this hypersensitivity reaction triggers an inflammatory response that is predominantly involving your alveoli and small airways, alveoli and small airways. So that is what is basically your hypersensitivity pneumonitis. Now let's try to understand the disease in more detail. See, I told you it is a hypersensitivity to inhaled antigens. So it is predominantly type 4 hypersensitivity reaction, type 4 hypersensitivity reaction. Okay, so it is predominantly type 4. Yes, there is a role for type 3 as well, because immune complex mediated pathology also happens, but predominantly it's type 4 over your type 3. Okay, so it is a type 4 hypersensitivity reaction in which you will have a participation predominantly of your Th1 cells and Th17 cells. Okay, now these are the predominant inflammatory cells in this hypersensitivity reaction. So obviously it is the adaptive immunity that is playing a big role by virtue of the Th1 and Th17 cells, but remember that there is a role for your innate immunity as well. Okay, there is a role for your innate immunity as well. All right. Now, though this is a hypersensitivity reaction, okay, we understood it is a type 4 hypersensitivity reaction. But remember, I told you it is against some inhaled antigens. Now, if you ask me, what sort of inhaled antigens? See, the nature of inhaled antigens can be varied. Okay, it is not a single type of inhaled antigen that causes the entity hypersensitivity pneumonitis. It can be varied antigens, like you may have a bacterial antigen triggering this, you may have a fungal antigen triggering this, maybe you might have some antigen that is derived from bird sources, that is someone who is dealing with birds might be exposed to some antigens. Okay, there may also be a chemical exposure as well. Okay, chemical exposure as well. So all these can be the antigens. Now, for your exams, you have got to learn regarding what are the common antigens which you encounter in hypersensitivity pneumonitis. Yes, it is a bit of mugging up, but no other go, because they may ask you as a factual question about a particular antigen leading to a hypersensitivity pneumonitis. There is a table in Harrison also on the various antigens that can lead on to this disease. So up next, we are going to see the table in Harrison that shows the list of antigens. So yes, so let's begin. As I told you, you might have the disease resulting from various antigen exposure. So see, when you talk about hypersensitivity pneumonitis, there are certain occupations that can predispose you to develop this disease. The first and foremost is those dealing with the farming and food processing. Okay, they are likely to encounter these antigens. Now, see, it is actually a big list. It's not just the list which you are seeing in screen. The list is actually more. But let me try to simplify it for you, and let me try to tell you the most commonly asked questions as well. See, in those exposed to the farming and food processing units, certain important antigen sources are there. Now, as you can see here, I have highlighted the thermophilic actinomyces here. So I just want to tell you this thermophilic actinomyces, this is a very important bacterial antigenic source. Okay, that is especially your thermophilic actinomyces, especially your Saccharopolyspora rectivirgula. Okay, it is a bit of tongue twister. So that is one common organism that is implicated. So let us try to see the first MCQ, that is what are the hypersensitivity pneumonitis types that can occur because of exposure to thermophilus actinomyces. Okay, so thermophilic actinomyces can cause, as you can see here, the very important one, farmer's lung. Okay, again, if I am asked to put one question on this hypersensitivity pneumonitis, maybe I would from this table, okay, I would ask regarding farmer's lung, because I would always prefer asking common and simpler ones, okay, rather than troubling students. So farmer's lung, yes. Then bagasosis, yes, that is also a hypersensitivity pneumonitis because of exposure to thermophilus actinomyces. Then you have mushroom worker's lung and also potato riddler's lung. Okay, so always keep these entities in mind, especially when they ask you a question with respect to thermophilus actinomyces. These are the hypersensitivity pneumonitis subtypes that you have got to learn in this thermophilus actinomyces. Okay, very clear. And in this farmer's lung, always understand that the source, okay, the source of the antigen, the bacterial antigen, can be hay or grains, okay, which can act as the sources. And for bagasosis, it is often sugarcane that is the source. Mushroom workers, it is mushrooms, and potato riddlers, it is the moldy hay around the potatoes. So these are the common ones, important. Okay. Now next one, again I will go with the organism wise. See, I am just going to show you the hypersensitivity pneumonitis associated with an Aspergillus antigen exposure. Aspergillus. Okay, let's see what are they. You see here in farmer's lung, not just the thermophilus actinomyces, even you can have fungus, that is your Aspergillus, also leading on to farmer's lung. So you can have the farmer's lung here. And Aspergillus clavatus exposure also can cause cheese washer's lung and also malt worker's lung, even potato riddler's lung and tobacco grower's lung. Very important. So it might be clear to you now that a particular disease, say for example farmer's lung, can occur because of exposure to not just your thermophilic actinomyces, it can also occur because of exposure to Aspergillus. Okay, very clear. So that also is important. Okay, and then I told you the hypersensitivity pneumonitis can occur because of exposure to certain antigens from birds. So the common one that you should learn is the bird fancier's lung, which can occur as a result of the hypersensitivity reaction to proteins from parakeets, pigeons, etc. Well, that is the most important one. Okay, so you keep that also in mind. And regarding the other occupational exposures, see, this one is very important, the one that I have highlighted, chemical worker's lung, often the trigger being the isocyanates. Okay, so I told you it is certain occupations, either a farmer or a bird owner, someone who is looking after all these birds, or maybe someone who is dealing with certain chemicals in the industrial factory. Okay, so this is isocyanates. Detergent worker's lung is related to an antigenic response to Bacillus subtilis. Hot tub lung, again very important, has been previously asked. Exposure to, first I would say, Mycobacterium avium complex and also the Cladosporum species. Previously they asked regarding Mycobacterium avium complex. Now these are the important entities that you should know. Now if you ask me, there are further other entities in this table, should I learn that? Well, the other ones have not been frequently asked, but again, if an examiner wants to trouble you, he can ask you that. But the ones that I have mentioned so far are the ones which are most important that you should definitely learn for your exams. Okay. Now, having seen the long list of antigens, okay, we have seen the bacterial antigens, fungal, bird sources, chemical exposure. Let me tell you one more thing, okay, or maybe let me ask you one thing. See, we just saw a host list of antigens, right? A big list. Will everyone exposed to these antigens develop a hypersensitivity pneumonitis? Answer is no, okay. It is not that each and every one exposed to antigens will develop a hypersensitivity pneumonitis. So it is not that the response is always universal to this antigen. There will be asymptomatic individuals who are exposed to these antigens. Okay, so there is some sort of unknown factors also contributing on why only certain individuals develop the disease. Okay. So far what have we learned? We have learned what is hypersensitivity pneumonitis, type 4 hypersensitivity, both adaptive and innate immunity, and it is predominantly affecting the alveoli and small airways. A big list of the antigens also we have seen, correct? Alright. Now next let us go to the clinical features. Okay, how do they present with? Okay, how do they present with? All right. Now, the clinical presentation of a hypersensitivity pneumonitis can either be acute, okay, it can be subacute, or it can be chronic. So, it can present in three ways: acute, subacute, or chronic. Now this acute is often a quite a dramatic presentation. Okay, that is when you have an exposure to a particular antigen, say after a few hours, okay, maybe a 4 to 8 hours after a exposure to antigen. Yes, in an individual who has been previously sensitized to the antigen, because this is a type 4 hypersensitivity. So if you have been already exposed to the antigen, and then subsequently you are re-exposed, then in a matter of around 4 to 8 hours, you have the immune response by the Th1 cells, Th17 cells, okay. So that results in acute manifestations. Now let me tell you one thing, whether it be acute, subacute or chronic, any of these would have two types of symptoms. One is going to be respiratory symptoms. And the next is going to be systemic symptoms. Okay. Now when I say respiratory symptoms, it is just that the patient would have some cough and breathlessness, okay, as symptoms. And systemic symptoms means patient may have, say, fever, fatigue, okay, as these systemic symptoms. Okay. So acute hypersensitivity pneumonitis, just think of someone who is already sensitized to the antigen on a re-exposure, mounting an immune response in a matter of hours, developing symptoms, okay, that is both the respiratory symptoms and systemic symptoms. So it will be like, you might think this is some other infection, maybe a pneumonia, somebody is having cough, breathlessness, some chest tightness, fever. Okay, so it is likely to be mistaken with another acute respiratory illness. So in a matter of hours and the symptoms develop. And remember that most often this would be a self-resolving one. Self-resolving one. Now when I say self-resolving, I mean that suppose the antigen has been taken off. Okay. This type of an acute response would subsequently resolve without producing any long-term sequelae. That is, if the antigen has been removed. Okay, in that case there is good prognosis. Alright. Whereas when it comes to subacute onset illness, what happens is that the patient can have symptoms which are ranging, or the onset and the progression can range from say days to weeks. Okay, it can range from days to weeks, and the patient would have the same symptoms like your respiratory symptoms and the systemic symptoms. Only thing is that it is not as dramatic as the acute hypersensitivity pneumonitis, and again it is sometimes difficult to diagnose this unless you take a careful history and you see that the patient's occupation is probably related to a trigger. Otherwise you will not diagnose this if you casually take the history. Okay, so over a matter of days or weeks, the same symptoms, the respiratory and the systemic symptoms, and again this subacute form also, if you take the antigen off, again this could be self-resolving. Okay, so this could be self-resolving, though sometimes treatment may be required, but the acute one is more resolving. Okay, and the chronic variety, well, it is again a progressive, slowly progressive course, which again the disease evolves over months. Okay, and in addition to the symptoms that we already mentioned, the patients may also have weight loss and clubbing. Patients may also have weight loss and clubbing. So that has to be kept in mind. Now the problem with this entity, I would say this man is a bit notorious in the sense that it is in this stage that you can have fibrosis setting in. Okay, fibrosis setting in. So when fibrosis sets in, you tend to have a bit of irreversibility to the disease process. Remember, the acute and subacute were relatively self-resolving, especially the acute one. But when it comes to the chronic one, it is likely to have a fibrotic process, and it can compromise the lung function test. Okay, so that is what you have got to know regarding the chronic form of hypersensitivity pneumonitis. Okay, so once again, a good history is always important, because that alone can lead you to the clue for the trigger for a hypersensitivity pneumonitis. Okay, all right. So we have seen the symptoms as well. Now let's go to the investigations. How are you planning to investigate a patient with suspected hypersensitivity pneumonitis? Well, like any respiratory illness, you can go for a chest X-ray. But let me tell you, the chest X-ray is relatively a non-specific findings will be seen in chest X-ray. You might have some nodular opacities, a few opacities bilaterally, mainly in the basal regions, but it does not give you any solid conclusion, or it does not lead you to the diagnosis. Okay, the findings are non-specific opacities. Well, you can go for your HRCT, which I feel is a very useful technique. So HRCT would show two most important findings. One is ground glass opacities. So ground glass opacities, that is again not specific to this entity. You can see in others conditions as well. Along with that, you can have centrilobular nodules. Centrilobular nodules. Now this ground glass opacities in case of hypersensitivity pneumonitis has a sort of mosaic pattern. Okay, has a sort of mosaic pattern. Okay, I'll tell you what this mosaic pattern is. I'll just show you a CT picture that is shown in Harrison itself. As you can see in your screen, this CT thorax is showing the ground glassing. Okay, so it looks a bit hazy. So, but you can also see that in between you have regions which are relatively spared. You see that? Okay, in between you can see, in between the ground glass opacities, you can see regions which are spared, and this sort of sparing creates a appearance that is called your mosaic pattern. Okay, mosaic pattern. All right, that is clear. So HRCT is very useful investigation modality. Okay, now you can have other findings also in HRCT, though these two are the major findings. You can have some traction bronchiectasis, some reticular pattern, other findings, other non-specific findings may also be there. Even sometimes a honeycombing can be there. Okay, but always keep in mind these 2 points. Okay. Now next, you can, after chest X-ray and HRCT, you can go for the pulmonary function test. Okay, you can go for pulmonary function test, PFTs. Okay, pulmonary function test. See, in the pulmonary function test in hypersensitivity pneumonitis, you can either have a restrictive pattern or an obstructive pattern. Okay, a restrictive pattern or obstructive pattern, but commonly what you see is that it is the restrictive pattern. But certain types of hypersensitivity pneumonitis, like your farmer's lung, can have emphysematous changes. Okay, so farmer's lung can have emphysematous changes. So it is not that each and every hypersensitivity pneumonitis is restrictive. It is predominantly restrictive, but you can also have obstructive pattern. And your DLCO will also be reduced, okay, in pulmonary function test. Very clear? All right. Now, especially the restrictive pattern may set in once the patient has gone for a chronic stage. So the findings that I have said, whether it be X-ray, HRCT, pulmonary function test, all will depend on the stage of the disease as well. You might see that some patient with an acute hypersensitivity pneumonitis might have an early normal CT. Okay, so probably if he is further exposed to the antigen and the disease process is continuing and he goes to the subacute stage, he is more likely to show the ground glass opacities. Because it is usually in the subacute stage that you best demonstrate these ground glass opacities. So similar is the pulmonary function test. As and when the fibrosis sets in, you are more likely to get the restrictive pattern. Okay. And then you can go for the antibodies, that is your serum precipitants. So serum precipitants against what? Means it is you can measure the IgG antibodies against these specific antigens that we have already discussed. Okay, you can measure it. Okay, you can go for the antibody measurement. Then you can also go for your bronchoscopy and BAL study. That is your bronchoalveolar lavage fluid. Okay, your bronchoalveolar lavage fluid, and you can go for the fluid estimation. Does it yield any specific finding? Well, there are certain changes that can occur in the bronchoalveolar lavage fluid. You can see that there is increase in the lymphocytes. There is increased BAL lymphocytes. Okay, you can say there is a BAL lymphocytosis. And they also talk about the CD4 to CD8 ratio. So most often the CD4 to CD8 ratio is less than 1. Okay, but don't think that this is diagnostic. You can have conditions, hypersensitivity pneumonitis with a CD4 to CD8 ratio more than 1 also. But in most of the hypersensitivity pneumonitis, the ratio will be less than 1. Clear? Okay. Then you can go for a biopsy, a transbronchial biopsy you can go for. So is it necessary to do biopsy in all suspected cases? Not at all. When you have a possible definite antigen and symptoms consistent with the hypersensitivity pneumonitis, it is better to take it as a HP and treat it rather than going for an invasive procedure like a biopsy. However, sometimes, especially in the chronic hypersensitivity pneumonitis, where sometimes making a diagnosis can be a bit tricky, in that scenario, you can go for biopsy. And what you get in biopsy, the finding is non-caseating granulomas, and sometimes, in addition to the non-caseating granulomas, you can get patterns like your NSIP pattern or UIP pattern. Okay, that is your non-specific interstitial pneumonia, usual interstitial pneumonia patterns may also be noticed, but again, one finding that you will mostly see is the non-caseating granulomas, because of which there is a chance that it might be mistaken for what? Sarcoidosis also. Okay, because this is again a very tricky entity when you take into consideration the differential diagnosis of this entity, okay, the DDs of the hypersensitivity pneumonitis. You will have the ILDs, that is your interstitial lung diseases, especially your, say, your IPF. Okay, the interstitial lung diseases definitely would form a part of the differential diagnosis. So is your sarcoidosis. Okay, so there is a likelihood chance that you may mistake it for these conditions. Okay, all right. Now going to the treatment part. Treatment of hypersensitivity pneumonitis. The acute hypersensitivity pneumonitis is usually a self-resolving one that I told you, and so there is no role for any pharmacological management, but subacute and chronic forms of hypersensitivity pneumonitis you can go for steroids. Okay, so you can put the patient on steroids, oral steroids, and try to maintain the patient on steroids and subsequently try tapering the dose. But once the disease goes to the chronic stage, and then once fibrosis sets in, again sometimes the patient may not show a good response to steroids as your subacute. So often the challenge is picking up the patient before the patient goes to a chronic stage. Okay, because it all depends on the extent of antigenic exposure, and the more the patient is being exposed to the antigen, there is a likelihood chance that he might have persisting symptoms. And let me tell you one thing, I think I should have told this first, because the most important aspect, in addition to all the management, is to avoid the further antigen exposure. That is the most important one. Because once you are again exposed to the antigen, you are likely to mount a immune response again. So as far as possible, if you are able to identify, suppose it is a bird fancier's lung, you try to avoid exposure to the birds. Okay, so the most important one is avoid the antigen exposure. Avoid the antigen exposure. Okay. So this is a simple and straightforward topic. Only thing is that you have to mug up the antigens which may be asked in your exam. Okay, so that's it, a simple straightforward topic. Just revise the antigens a couple of times and I'm sure you will be able to answer it. Okay, thank you.